You don't want to believe that your kid's going to be anything different than the normal little happy kid down the street.
Megan's always been pretty energetic, and we thought we were just older parents and didn't remember our older two being that energetic.
Other children were learning to control those emotions and those behaviors, and he couldn't control them. And kids would come up to me and say, "Why was your son mean to me today?" And it would break my heart.
Children differ in ability and personality, just like adults. Normal covers a wide range of types: the loner, the daydreamer, the wild or slow or smart child. No! But some children go beyond type, behaving in ways that prevent them from fitting in.
I was only 6, and that's an age that teachers are not supposed to yell at little kids, because I was just little and I couldn't help it that much.
Parents come into us because their child is experiencing some difficulty.
There's lots of reasons why a child might be having behavior problems, and it's our job as developmental and behavioral pediatricians to figure out, well, why.
I was born different?
Right. It hurts you because Jean drank alcohol while she was pregnant with you, and it made things work differently with you than other kids, huh? Yeah, so we just have to work harder at things now, don't we?
Do that.
As scientists learn more and more about how the brain works, regular doctors, under the constraints of managed care, spend less and less time with patients.
And who is this handsome fellow?
At St. Joseph's Hospital and Medical Center, Doctors Kessler and Blitz take the time to study the clues of a child's physical, intellectual, emotional, and social behavior.
Which one talks, Jake? Show me, which one talks?
They are as much detective as doctor, because each child they see presents a mystery that has baffled parents, teachers, and even other medical professionals.
You have a kid that you think is fine, and then you start questioning, and you start saying things and questioning people. What's going on here? And everybody starts to write you off. You're just, it's our first child. You're just the over-anxious mommy.
The doctors would look at me and say, "Oh, you think she's this bad now? Wait until she turns 2." And then they'd laugh at me and pat me on the back.
Our pediatrician was very quick to write prescriptions for Ritalin, which is not what we needed. We needed a comprehensive analysis of where we were. And Dr. Kessler provided that.
Parents are the experts on their own children. And we, as their consultants, need to listen to their concerns and act on them much more quickly than we have historically.
I see my job is recognizing what the developmental or behavioral issue might be, and then helping figure out how this child and this family can be the most functional and the happiest and most productive. And then does he sleep all night or no?
That's a time-consuming job, requiring hours of observation, examination, testing and screening, record and research review, phone interviews with relatives and teachers, all to figure out why, and then to figure out how to meet the special needs of a child who is otherwise destined to fail.
It's hard having a child who has special needs, and it's hard not knowing why your child is different from other children. And then when you help that child to achieve and participate with those other children, it's a wonderful feeling.
There's just one problem. Doctors Kessler and Blitz are booked solid. It can take more than a year to set up an appointment.
So that's a 14 months longer that a child has to wait for intervention. And that's a crucial 14 months. When you're talking, these children are young, they need that 14 months.
We've had several friends that we have referred here. They're out of luck. They're on a waiting list. Meantime, their kids are growing up without the help they need.
History has shown that children who do not receive early intervention in the form of helpful therapies often flunk out or drop out. They do crime and time. They drink and drug.
If we want to develop a healthy workforce, these are the kids who we're going to need to pay attention to.
That's our urgency behind Dr. Kessler's vision to grow this small clinic into the Arizona Child Study Center, with more doctors, psychologists, psychiatrists, therapists, and counselors for a fully coordinated and integrated multidisciplinary diagnostic, treatment, and training center to take care of the thousands of kids who cannot now be helped.
One of our goals as developmental and behavioral pediatricians is to train general pediatricians in how to work with these children in the community. And there are lots of great pediatricians out there who are doing it, but not enough.
Every family, I am convinced, or the overwhelming majority of families, provided the right information, the right resources, want their kids to be happy and successful. They simply need help in reaching those goals.
He's done beautifully. We found really solid support through our school, but we have had to be his advocates, and Dr. Kessler has enabled us, empowered us to be his advocates.
My child now is doing much better through therapy and early intervention programs and medication that's monitored by Dr. Blitz. He's going to go to a regular kindergarten class in the fall, which we're very excited about. And we would have never gotten to this point without having her.
She's the only one, the only child with fetal alcohol syndrome that they know of that is successful in the regular education environment.
And to what do you credit that?
Myself learning everything I can about fetal alcohol syndrome, and Dr. Blitz has been there guiding me in the whole way. Yeah.
She gave us back our little girl. I mean, when she turned 3, I don't know what happened, but it was like, oh my gosh. And so after we started with Dr. Blitz, it's like a miracle.
This is your family.
Child by child, Drs. Kessler and Blitz invest the time, the knowledge, and the heart to equip each child for some measure of success in the larger world.
You can do it. You did it last time.
And the larger world benefits from each child's small step toward becoming balanced, productive people. In the end, the need for and the value of the Arizona Child Study Center is as much about all of us as it is about each of them.
We were very fortunate, but how many kids out there that don't have a chance, and they're great kids, and they don't have a chance because nobody's helping them, nobody's telling them what's wrong. They think it's them.
The science of understanding kids' growth and development and needs, the issues of behavioral health, emotional health, social health, we know what kids need to thrive in this society. We're simply not providing it.
Yet the foundation to meet those needs is already in place here at St. Joe's. By expanding upon that foundation, the Arizona Child Study Center will be able to ensure that the thousands of children currently in need of these vital treatments can be helped before it is too late for them, their families, and our community. But there is something else at stake. Can St. Joseph's Hospital and Medical Center continue to live up to the praise of a mother named Colleen Riley?
She gave us back our little girl. It's like a miracle.